Hey y'all, we're back with COPD. COPD is chronic obstructive pulmonary disease. Okay, and just a quick overview of the disease. It is a chronic inflammatory lung disease and it causes obstructed airflow from the lungs. Okay, it is a very common condition and it mainly affects our middle age and older adults who smoked in the past or still smoking, who have smoked. Okay, a lot of the times it's caused from smoking. Okay, some symptoms of this is breathing difficulty, that dyspnea, shortness of breath, that exertional dyspnea, cough, mucus, especially productive mucus, okay, or a productive cough, and some wheezing. All right. Again, the condition is mostly caused from smoking, and the best treatment is to stop smoking. Okay, stop smoking. But let's do a deeper dive. Okay, we're going to do a deeper dive. Your pathophysiology behind this is chronic bronchitis, okay, inflammation of the bronchi, and then emphysema as well. Okay, so what is emphysema? Okay, what is it? That's what we need to talk about first, so you guys can really get a better, understanding of this. So emphysema, it is a lung condition as well, and it causes shortness of breath and reduces the amount of oxygen in the blood. Okay, that's pretty much what's going on when you talk about or when you think about emphysema, and it damages your alveoli. Okay, it damages your alveoli, especially over time. So that chronic bronchitis, along with that emphysema, equals your COPD. Okay. Your etiology, again, as I mentioned, exposure to cigarette smoke, either directly or secondhand. Okay. There's also another one, noxious gases. Okay, noxious gases. That's where I just want you to get that verbiage. That's like secondhand smoke. Okay, being around the secondhand smoke and the exposure. Okay, so this impact, of course, this is a respiratory disorder and this is a very chronic one. So the impact on the overall health, your patients that have COPD, they have an increased risk of developing pneumonia. Okay, pneumonia, as well as an increased mortality rate due to respiratory failure. So I will create separate videos on pneumonia and a separate video on respiratory failure as well. The systemic effects of COPD are your weight loss, okay? Weight loss, skeletal muscle dysfunction, and even poor nutrition, okay? That skeletal muscle dysfunction is a result of having a poor diet, that inactivity. I mentioned having the exertional dyspnea already and giving you guys that in the overview. So they're not going to be very active because as soon as they even get up from a chair, okay, they're going to be out of breath. Okay, they're also going to have some hypoxia. That gas exchange, it's barely happening because their alveoli is damaged. They're no longer little grape-like sacs anymore. Okay, they're open and deformed. So we know the gas exchange happens in our alveoli. That's not taking place adequately anymore. Okay, there's also going to be some inflammation, all of which contribute to the poor health status and the decreased physical activity that they're going to have. So again, they're at an increased risk of developing pneumonia, an increased risk of having respiratory failure. Okay, they will have a poor health status and decreased physical activity. Okay, your older individuals, your aging adults, okay, the advanced age is a high risk for COPD, especially if they have that history of smoking. Okay, so just be mindful of a lot of those things. Your manifestations, again, let me break them down. Exertional dyspnea, anytime they try to exert or use any energy, they're going to have a difficulty breathing. Okay, imagine trying to run, and you really can't breathe. It's going to be very hard, right? Chronic cough with sputum production, so that productive cough. You're going to hear some wheezing, okay? Your adventitious breath sounds are going to be some wheezing, okay? And they're going to complain of chest tightness. Chest tightness, they'll also have like this barrel chest appearance, okay? Their chest will be like Donkey Kong chest, okay? Barrel chest appearance. They will have some weight loss, as I mentioned, especially with that advanced COPD. Okay, some lab tests and stuff that they're going to do for these patients is spirometry. Okay, they're going to do some spirometry. They're most likely going to have to see a pulmonologist as well. And then there's an acronym for a questionnaire that you can use as their nurse. It's called CAPTURE. Okay, CAPTURE, CAPTURE. The C stands for COPD, chronic obstructive pulmonary disease. The A is assessment. Okay, the P is primary care. The T to identify what was the cause. Okay, U if it's gone undiagnosed. Okay, R respiratory disease, and E exacerbation risk. Okay, do they pose any risks for exacerbation? All right, so your role would be to utilize that capture. Okay, and then be aware of any environmental risks. Any disorder, you always want to consider environmental risks. Anxiety, okay? Occupational exposures to certain irritants that's going to affect the breathing, all right? If your patient is experiencing severe manifestations of COPD, they can present with anxiety, okay? Think about if you were struggling to breathe. You're going to get anxious and stuff too and start freaking out because breathing is essential, right? Breathing is necessary. So if you cannot do it, okay, your anxiety is going to be through the roof. Same with these patients, okay? A relaxed, focused approach is best, okay? It's best and is beneficial to your patients, okay? So as their nurse, you want to create a calm environment and calm situation, okay? That will help to ease their anxiety, okay? Risk factor exposure should also be identified. Was it secondhand smoke? Were they smoking packs a day? Okay, it should be identified and also addressed. All right, smoking cessation if needed. Those should also be provided as a form of intervention to try to get them to stop smoking if they are smokers, which in this case, 9 times out of 10, they probably are or they probably were. But your ventilation that is efficient, not anywhere where there's fumes or if they're in an environment of secondhand smoke or any of that, you want to remove them from all of that. They shouldn't be living with family members that smoke or anything like that as well. Okay, but a lot of the time this is going to be self-managed. Okay, so teaching your patients and educating them on how to manage their stress. Okay, motivate them and keep them engaged in their own care. They will be very discouraged. Okay, they will be very discouraged, but keep them engaged and kind of guide them and motivate them to be involved in their care. All right, so apply your nursing process to this. Okay, go through every single step, recognize your cues, do your assessment, analyze your cues, prioritize your hypothesis, generate solutions, take actions, and evaluate your outcomes. Okay, so once it's determined in recognizing your cues for this patient, once it's determined that the client is not in a respiratory crisis, but in which you would do this by obtaining a history, complete a full physical history as well. But once you get you recognize the cues and you ask about any current manifestations that they're having at this moment, or that they've had in the past. If they've had any coughing, any wheezing, any breathlessness, okay, increased intolerance to activity, that exertional dyspnea, okay, if they've had production of sputum, any changes in their mental status, you want to get all of that, and all of that should be assessed. Okay, it should be assessed. You should ask them questions as well about their smoking history, first and foremost. Then, once you get all of that information back, you're going to analyze the cues. Okay, monitor your patients for any gasping. If they're gasping for air and they're struggling, that's what you're going to look for. You're going to analyze that. That could mean that could mean reactive airway. Okay, reactive airway means air can move in, but it cannot move out. Okay, that's reactive airway. The dyspnea, as I mentioned, the manifestations that indicate respiratory distress. Okay, you want to analyze all of that. Next, you're going to prioritize your hypothesis. Okay, so when prioritizing the care for these patients, you want to make sure that their airway, they have a patent airway and adequate oxygenation. You do not want to over-oxygenate someone who has COPD. They should be on 2 liters oxygen and 2 liters max, okay? Their lungs cannot handle it, Okay, they cannot handle it. So you want to aim for a normal oxygen saturation of a 95 and 100 without over oxygenating them, but just be mindful that them having a lower O2 sat is normal for them. That's an expectation for them. You can aim for a normal, okay? A normal with a 2 liter, but if you get a low 90s, that's probably their normal, okay? So I went all the way into already generating your solutions, okay, for your talking about your O2. Now it's time to take action, okay? Promote rest, promote breathing exercises, okay? Your client should rest, especially if they're fatigued. Again, I keep stressing that exertional dyspnea, okay? Encourage moments of rest, okay? Pursed lip breathing. Pursed lip breathing is key. Breathing moves air out of the lungs and elevating your head of the bed, high Fowlers. So sit them all the way up and pursed lip that's pursed lip breathing, okay? Pursed lip breathing, and then you want to evaluate the outcomes, okay? Evaluate the outcomes. And that's pretty much it for COPD. Y'all got this.